Hey, thank you for tuning in. In the wonderful state of New York, we're actually in the city, and wonderful. I got to meet up with Dr. Brian Hutcheson, which many probably have known and seen on YouTube. Probably about 60% of what I've learned in cervical instability, upper cervical instability, and even the symptoms that come with craniocervical syndrome, I've learned from him and various doctors he's worked with. So thank you for taking a vacation here, first of all, and for meeting us.
It's a pleasure to be here, Robert, right in your home city of New York, and thank you for spending time, and I'm looking forward to chatting with you today. So.
Thank you so much. So this is, of course, my actually first real interview that I've wanted to do with various doctors who are well skilled in this particular area. And my original goal, suffering from cervical instability myself, now I might look normal right now, but that's the medication talking. So I wanted to start off with explaining about why I started CCI Fund, and it's a slow progress, but there's just a lot of information that people don't know, even the medical industry doesn't know about these particular conditions, and especially how to find them on radiologic studies and or see those symptoms. And a lot of us tend to be pushed off into various areas that are not addressing the actual root cause. So Dr. Hutcheson, I wanted to start off with a number of questions. I've seen a lot of your videos, and you started a 3-step process, a rehabilitative cervical lordosis technique. Could you tell us a little bit more about that?
Of course, Robert. Thank you so much for bringing that one up to start. And the 3-step process that I created is where you get a lateral x-ray, and then we fit you with a certain kind of spinal rehabilitative weighting system, and you use it, as prescribed. And then after 4 to 8 weeks, we recheck on that lateral x-ray to see if there's been progress. Now, you probably will ask, the next question would be, what about all the other factors that come into play? And typically we do review an entire DMX, all of your MRIs, we review all the other scans you have, because that can help to determine what weights that you're going to be able to tolerate. We also do an in-person exam or remote. I can assess, how your body is in space. You can show me with an athletic shirt on, how you sit, how you move, your range of motion, what you're able to tolerate, and I learn about what's going to be best for you so that we can give you therapy to do at home that's going to start improving your cervical spine curvature and bringing strength. Sometimes it's just prehab, but sometimes you get pretty far with just even a remote type of a treatment plan like that.
Thank you. One of the things that a lot of patients run into is when we think instability and dealing with weights, curve correction, and even myself, I can say that I'd be rather fearful that would the weights not cause the head to shift in the improper direction, and I know that you yourself apparently fixed your own instability.
Yeah, it's pretty incredible, because when you have cervical instability, yes, you need to be careful. You shouldn't be doing high velocity adjustments when you have upper cervical instability. That is one of the contraindications to high velocity adjusting, is instability at that level or segment. But Robert, to answer your question, this is the only kind of care that I've been doing for the last 3 years. It's been the very hard upper cervical cases with 95% of people having significant instability. And I figured out a way to know what people can tolerate. And these people that are going through these problems, they're usually suffering every day already, right? So, every day you may have a quick window where you feel decent for 10 minutes, an hour, 2 hours. At times you feel better than, your worst, but you're already having a hard time. And what we found when I worked at my previous job was that over 95% of people could start care with spinal weighting while they were beginning other regenerative medicine techniques or procedures. And there was only a very small percent that needed to get more stability before they could tolerate weight.
Really? Yeah, because in my course in this, and a lot of patients probably feel the very same way, they've gone to a particular professional that wasn't very well trained in fact trying to find instability. And they've done those manual thrusting techniques, and I've been there with many chiropractors, and I'm not lashing out at any chiropractors. They're all good doctors. It's just a lack of training. And maybe you can just quickly tell me, is this something that's taught in school? Cervical instability or upper cervical instability. Is that something that's trained to be looked for?
It is. It is taught in school. However, the reason that we're here today is because there needs to be more research into upper cervical instability. And I think that it's becoming more widespread knowledge that the upper cervical spine can control almost anything in your body and can cause symptoms that people would have thought otherwise that it couldn't, from heart fluttering to heart palpitations to tingling in your toes to brain fog to feeling like you're not yourself, like you're on a boat. I mean, the list is probably 100 different symptoms or more, maybe even 200 that you could feel like depersonalization, like you're not in your body. You could feel incredible amount of anxiety, and you're doing everything else right. You're on supplements, you're praying, you're meditating, you're eating well, you're trying to be a peaceful person, but you still feel like you're going insane. And so the structural or physical pathologies that can cause these very severe life-threatening conditions are still not fully understood. And that's why we're pursuing this area and bringing light to it. So with that being said, yes, we learn about it in chiropractic school, just as medical doctors learn about upper cervical in medical school, but it might only be a day or it might be a week. And this area, to become really good at it, takes a lot longer, probably at least a year or years to really get good at it. So.
Yeah, because I know it's like with all of us, the patients who are in the community of instability, we hear of doctors like Hutcheson, Dr. Katz, Dr. Rosa, but we also hear of those other horror stories, so to speak, because there's just that lack of training. And this is why I'm really glad that Dr. Hutcheson, you're now doing virtual consults.
Yes.
The question I have, because I guarantee a lot of those who are in the United Kingdom don't know who to go to because there's no digital motion x-ray there, and it can be very hard to get care. So one of the questions I had, if you're doing virtual, what could they do with standard x-ray, what you would need to help maybe come to at least a sort of a diagnosis that there is either instability or lack of curve or even just an answer for their symptoms?
Yeah, that's a great question. And I've done a couple of consultations or tried to guide people in the UK, and they've gotten MRIs, they've gotten flexion extension x-rays, they've gone to Spain and seen a neurosurgeon there and gotten more imaging as well. Dr. Gillette will do cone beams with rotations, certain kind of MRIs and stress viewed. So there are areas in Europe where you can get enough diagnostics done where we can get you started. It depends on the severity of your case if you'll need to travel to see a doctor in the States. But the question we had before that, when we were talking about adjusting and different chiropractic approaches, was that I wanted to add in that often people that go to a chiropractor and then they say they feel worse after, that they, in my belief and in my experience, is it why did they go to the chiropractor in the first place? Because this is what people don't consider when they, there's been other doctors that have said, oh, well, every time you get a manual adjustment, you're causing an injury. And that's absolutely not true. Manual adjustments can be very healthy and helpful. But what happens is, Robert, somebody went into the chiropractor and they had a problem, right? Yeah. They very rarely were they like swindled into a way to go. I mean, in every trade, there's one outlier that, is inhonorable. But usually they went to the chiropractor because they either couldn't turn their neck, they had headaches, they had some problem. And what the chiropractor did was freed up that spot that was trying to fuse itself because there was underlying instability already. Mm-hmm. Now they got it moving, and now you're getting, vagus nerve interference, you're getting jugular veins getting hit, you're getting spinal cord compressions, CSF problems, because now the motion is there. And they'll say, well, I never felt this bad before. Yes, because your body was very carefully, we have this innate ability for our body to find the way to create, a defense system. So it was creating that defense system, but you still felt terrible, and it was only going to get worse. So now that you actually got that adjustment, there was a bigger problem under there. So do I recommend that almost everybody should get a minimal view DMX before getting, big powerful upper cervical adjustments? Yes, I do. However, I just want you to know it's usually not the chiropractor that did the damage. The damage was there. They got the mobility, and now you're getting the neurologic symptoms.
That makes a lot of sense because a patient I was talking to yesterday had his first treatment with an Atlas orthogonal, and his systemic went offline. Everything he was walking heavy, feeling a little bit pressured, feeling dizzy, feeling off balance, and it was a very scary sensation. Now, my understanding is that the brain gets used to subluxation, it gets used to the imbalance that they had for all these years, and then suddenly when you put them back in alignment, the brain's like, this is not my normal.
Yeah.
I like the abnormal normal.
Yep.
And therefore
That's a great question. And my answer to that question is that it's not always the atlas alone that needs to be adjusted. So you may have set the atlas in perfect alignment, but they may have an occiput that is shifted posterior on that atlas.
Yeah.
They may have C2 malrotation that didn't get fully unlocked when you adjusted the atlas. They could have a problem lower in the neck. So if the atlas got lined up just right, but the skull is still in the wrong place, and it's barely, it could be something that doesn't show up on a vertex view or on an upper cervical adjustment, or they could have, the muscles are completely atrophied and dead. So when you set that bone in place, but the bones were kind of resting in a way that was a defensive barrier, and now the bone is allowing more motion because you set it in place to create better motion, to have integrity. So another problem could show. So we have to be thinking about rehabilitating the longus capitis, the longus coli, the posterior spinal musculature, to make sure the curve is right. If the head is too far forward, Robert, and you set C1 in perfect alignment, you're still usually going to feel pretty bad when you have one of these more complicated conditions. And so you have to get the head back over the body, and then we usually work more on setting precisely C0, C1, C2. But if you're here, think about you have a 10-pound head on a 2-ounce atlas, and so you set the atlas in alignment. How is that going to, in these hard cases, how is that going to be the final solution? Unless you get everything here, and then you can do the fine-tuning.
makes a lot of sense. I was about to cut you off. I wanted to let you finish.
Go ahead,
Because one of the cases I actually saw, Dr. Jeffrey Middleton, who was also Atlas orthogonal, at least, in one of his videos, he showed, even though he can get C1 straight, the person had a calcific facet joint that would not unlock and would not move. So then how could he go any further? You can reset C1 all you want to. So it's a very important thing. It is true. We have to look at the whole entire cervical spine. Now, is it just cervical spine only, or do you have to see other areas?
Yeah, you have to take it case by case. There have been individuals where I've had to correct the lumbar lordosis in order to correct the neck problem.
Wow.
Because there's spinal cord tension, right? If there's more than a 10% stretch on your spinal cord, it starts to undergo plastic deformation. And if there's over, I think it's 15 or 18%, it's seriously causing abnormal signaling in the entire spinal cord. So if your lumbar spine has a horrible curve and you have scoliosis and you're only working on the upper neck, that's a good place to start, but you may have a lot of limitations if you're not addressing the whole spine.
Wow.
So, yeah.
One question I have, and this is more of the challenge question. Forward head posture. I've seen forward head posture since videos were created. People had look down jobs forever, and my father has extreme forward head posture. My neighbor is shifted forward and crooked like a question mark. But they're living okay. They're fine. They go to their flea markets. They live normal. So why is it that some have forward head posture, but they don't have any problems? They're living okay.
So my answer to that is, like you used for an example, your father, right?
Yeah.
And so the older generation, they got this very slow over time. Because what they did was, over time, they weren't on phones and computers, right? So over time, from look-down jobs and things, they got this way, but it was very slow and gradual, and the body could accommodate and adapt, and innate intelligence, God-given ability to heal, figured out how to do it correctly. But now, like never before, we've been on these things like nonstop, at a rate that's never happened in human history, and it's created new and different problems in the spine that the body didn't have time to innately adapt to. So now we're all much more vulnerable to neck injuries.
That makes so much sense.
It was over time. You might have read the paper on Sunday, right? And had a bad posture, but then you went out in the yard and you cut the grass, right? And then you went to, meet with friends. And so now people will be 8-10 hours a day like this, and they won't get up except to go to the bathroom and maybe drink a little bit of water, and then they're just sitting like this. And then they get in one car accident and they're here, boom, and their upper neck was so weak. And before, people were stronger overall with these kind of conditions.
Yeah, and especially now. I mean, we are in a genetic world, the mutation genetic. I mean, EDS went from 4%, now it's extremely high. I mean,
okay, good. You bring in the other part too. Chemicals over the last few generations have definitely increased, and maybe our connective tissue is not as strong on average. We could look at, there's probably a way to test that, but that's a good theory. That
yeah, especially ever since Carnation Instant Breakfast came out, aluminum cans. I mean, I've seen it. I mean, I've been looking at this for a very long time, and I like to challenge professionals, even like Dr. Hutcheson, because because I see some other YouTube clips on like forward head posture is an epidemic, but it's been around for a very long time.
Yeah.
But there's other factors that we have to look at, and the areas of pathology we were talking about before we were recording is physical, chemical, emotional, and also spiritual. And let's face it, we do know that someone who is scared before giving a talk in front of the room, or their fear at the sight of blood, their brain will make them pass out. So the brain is a very powerful tool of healing. And that's what even gets in the way, because I know when I was at my peak of suffering, before I tried prolotherapy, going to more of the manual thrusting adjustments, and I was in a very, very bad place at that time. And so those since I was getting scared to try anything. And so at this point, this is the question I think I find in the community is regarding those who are too scared to do anything. You're probably right now maybe wearing an aspen collar or a soft collar. You're probably laying down a lot more often. How can we help patients to not isolate themselves and think, I need fusion. My life is over, I need fusion. How can we get them to trust the community again of conservative, from chiropractic care, even regenerative medicine?
Yeah, that's a great question. And my answer to that is that the very best surgeons require you to do prehab and rehab. So even if you believe that you absolutely need to get a fusion, what you may, and I've sent patients to get fusions and they've done very well. It's a C0 to C2 fusion. I have one patient in mind that I sent and reduced her seizures down 95%. I mean, she would turn her head to the left and she would start seizing and, have to fall down to the floor after 10 or 20 seconds. And couldn't get out of them unless I did a very specific adjustment, or she took a super strong, almost like a tranquilizer type intranasal medicine that could help get her out of it. I mean, it was very severe. So surgeons can save your life, and they are one of the options for these kind of injuries. But prehab is going to be very important. And if you're not doing something to try to improve your functioning, then I think you're doing yourself a disservice. So it would be wise to find, I have one person that I'm consulting with right now that said, Robert, he said, I'm in bed 22 hours a day. And so I told him, I said, even if you're going to go and get these other things done, you need to find a way to only be in bed 20 hours a day and then 18 hours a day. And so you need to have something you're doing proactively.
Yeah.
So let's start. Let's see what little exercise can we give you to have you start being a little bit more functioning, so your body's laying down better connective tissue, so that you're giving yourself a chance to be ready for whatever regenerative procedures you do, or to respond better to healing from surgery. After you get a surgery, your body needs the building blocks to still, make that really, have the longevity that you want.
Excellent. The last question that came to my mind right now is, there's a getting worse or feeling of getting worse before they get better. I noticed that with whether it's Atlas orthogonal or even CBP type of maneuvers. And the question is how does a patient handle those moments? Like if they go once, if I go once to you and I feel like I'm getting corrected, and I'm like, oh my God, Brian, I have head pressure, I have this, and I'm feeling worse.
Yes, great question. And that's one of those reasons why I'm very reluctant to take on a patient that says, can I just dabble with your plan? Because even if we give a very, very careful, curated plan that has almost no chance of doing any harm to you, you still could feel a little bit worse the first time you try it, the second time you try it. And so if you have the people that just want to dabble, that's going to be dangerous for you, because you may go to the right person for you, and you may not start getting results until you've worked on that plan for a period of time. So now that period of time should happen pretty quickly. If it's regenerative treatments, it should be within the first 3 treatments. Absolutely. I've only seen 1 or 2 times that's taken longer to that out of 1,000 patients where they needed more than 3 to start seeing return. But sometimes you're not doing the right therapy, because you might need to work on the curve first. But definitely go, when you have consulted with somebody like Robert, you talk to all the doctors, and you're sure what plan you're going to start, you have to go all in. Because if you're only going to dabble, you might just... Have you ever seen those diagrams, Robert, where they're digging, they're like memes, and somebody's only like 2 more shovels full to get to like their golden prize, and then they stop because they get frustrated? You have to give these things a little bit of time in order to see the results. And there are miracle cases where 1 visit and somebody's cured, but it's more often that somebody's had to work on this for a few weeks or even up to a month before they really start to get the benefit.
So hopefully the noise ain't too loud, but I wanted to ask one more question.
Yep.
Do you send patients out to any other type of conservative treatments? For example, I started to go to see a functional neurologist who was looking at my visual convergence and
Yes.
VOR, and he said, you pass what everyone fails and you fail what everyone passes. So, and I noticed that, which is why I don't particularly drive too much, because the information overload, something's going wrong. So is that something maybe within your care plan to resolve itself, or do you ever feel the need for going external?
It's a great question. One of my colleagues and I spoke about this about a week and a half ago, and he does the Carrick Institute, chiropractic neurology. And it's interesting because in that institute, they believe that it's everything that's wrong up in the brain that causes the problems lower. But if you think about it, if at your cervical cranial junction, you have an abnormal amount of blood going in and out, you have direct pressure on one of your most important nerves, or your cerebral spinal fluid is stagnated, you have intracranial hypertension because of a structural deficit, it just seems hard for me to believe that if you only fix the way that the brain is, that you're going to fix the blood flow in and out of the head, the spinal cord tension you're going to eliminate. And so I feel like if you know for sure that there's a structural problem that's impeding flow in and out of the head, that you have to treat that first. And you can treat it concurrently with some neurology things, some visual exercises, and you can have that going concurrently, just like you should be with curve correction. You can also make sure your oxygen's high, you're eating super healthy, you can do some neurology. But if you're not improving the connection between the brain and the body, and that's the primary lesion, then you're never going to fully get it to resolve in my chiropractic,
It makes a lot of sense. You can't just try to map the brain. Anything that's brain mediated, you're only gonna try to correct that neurological flow through an abnormal structure. So it just doesn't make sense.
Exactly.
Yeah. So
Okay.
Listen, I think I ran out of questions. I probably have 1,000 more, especially when it comes to imaging, because that's my love, radiology. So I want to thank you for taking your time to meet with us. You're my first video, and I think everyone's going to learn a nice lesson here that we have to be careful. Us in the CCI community, from 2018, I went bedbound, and I actually stuck to that routine. And I was that one of those 22 hours a day laying down, up and down. And I decided, no, I'm not going to allow this to happen, because I know a body in motion stays in motion, and the opposite's true. And so I would not be sitting here if it wasn't for a good chiropractic care and a good regenerative medicine doctor. I would not be where I am. So Dr. Hutcheson, thank you so much for taking part of your vacation time to meet with us and be able to help the community and spread this knowledge about upper cervical care.
It's been a pleasure, Robert. Thank you so much.
Thank you.